Hey everyone, and welcome. If you're studying for your nursing exams, you are in exactly the right place. Today we're going to do a deep dive into some really critical topics: recovery, wellness, and chronic care. My goal is to break all this down for you, so you can walk into that test feeling totally confident.
All right, but before we really get into the weeds, do me a quick favor. If you find this helpful, and I know you will, go ahead and hit that like button and subscribe to Rapid Review RN. That way you won't miss out on any of our other study guides designed to help you crush your exams.
Okay, so here's our game plan for today. First, we'll tackle the physiology of chronic stress. Then we'll jump into recovery-oriented and wellness care. After that, it's all about sleep and its disorders, plus how we intervene. And we'll finish up with the crucial topic of caring for serious mental illness. You'll see how it all connects. Ready? Let's do this. All right, first up, the physiology of chronic stress. We have to start here, because understanding the body's alarm system, it's just so foundational. Seriously, this one concept is the key to understanding so many of the chronic conditions you're going to see in your patients every single day.
So, let's break down what happens in the body when stress hits. Think of it like a chain reaction. First, bam, a stressor appears. Your sympathetic nervous system flips the switch, activating that classic fight or flight response. This immediately triggers a rush of adrenaline. Your heart pounds, you're laser focused. But it doesn't stop there. Right on its heels, the HPA axis wakes up and starts pumping out corticosteroids, especially cortisol, to keep your body on high alert for the long haul.
I love this friend and foe comparison because it's so true. Cortisol is kind of like a superhero in short bursts. It's your friend. It helps you power through an emergency by boosting muscle endurance and dulling pain. But when that stressor never goes away and cortisol is pumping out 24/7, it becomes a total villain. It absolutely wrecks your immune system and opens the door to all sorts of chronic health issues. This is a huge concept for the NCLEX, so make sure you've got this down.
Okay, so knowing how damaging chronic stress is, that brings us perfectly to our next section, recovery-oriented care. This is a really big deal in modern mental health nursing. It's a huge philosophical shift. We're not just trying to put a Band-Aid on symptoms anymore. The real goal is to help people build a meaningful life and empower them to be in the driver's seat of their own recovery.
And a great way to remember the core principles of recovery is the CHIME framework. This is one of those things you'll definitely see on an exam. So C is for connectedness, feeling like you belong. H is for hope, believing that recovery is possible. I is for identity, knowing you're more than just your diagnosis. M is for meaning, having a purpose that gets you out of bed. And E is for empowerment, having control over your own life. CHIME. Got it?
So what's our role in all this? Well, a huge part of it is patient education on whole body wellness. Let's look at how you can frame this. For exercise, you can tell your patient, hey, moving your body actually increases something called BDNF, which is basically like miracle grow for your brain cells. And you can give them a totally achievable goal, like 150 minutes a week broken into little 10-minute chunks. Or for rest, you can say, getting good sleep is just as powerful as your medication for keeping your immune system strong. These are simple but incredibly powerful teaching points.
Okay, you're doing awesome. Let's put that knowledge to the test. Time for a practice question on recovery-oriented care.
All right, here's the scenario. A nurse is working with a client on their recovery plan. Which statement by the nurse best demonstrates a strengths-based, recovery-oriented approach? Is it number 1, you must adhere to your medication schedule to get better? Number 2, let's focus on what you can't do right now? Number 3, what are some of your personal goals you'd like to work towards? Or number 4, your diagnosis means you will have these limitations. Think about it for a sec. Which one feels the most empowering?
And the correct answer is number 3. Why? Because it hits that E in CHIME, empowerment, right on the head. It's asking the client what they want, what their goals are. It puts them in charge. The other options? Well, 1 is just an order, 2 is focused on deficits, and 4 is just plan limiting and pessimistic. 3 is the only one that's truly strengths-based.
Awesome job. Okay, let's switch gears to something that's the absolute foundation of health: sleep. I mean, think about it. It's when our bodies and brains do all their repair work. So when sleep gets messed up, well, everything else starts to fall apart too. So let's talk about what a normal night of sleep actually looks like. It's broken down into 2 main stages. Most of the night, about 75 to 80%, is spent in NREM sleep. That's your deep, physically restorative sleep. The other 20 to 25% is REM sleep. This is where the magic, and sometimes the trouble, happens. REM is for dreaming and memory consolidation.
And a key feature is muscle apnea, meaning your body is paralyzed so you don't act out your dreams. Now think about a condition like PTSD. This is the stage that gets hijacked, leading to those awful nightmares.
Okay, so let's talk about a major sleep disruptor, obstructive sleep apnea, or OSA. When you're assessing for this, think about the clues your patient will give you during the day. These are the things they'll actually complain to you about. They'll say things like, "I'm just so tired all the time," or "I wake up with a headache every single morning." They might be irritable, moody, and just feel like they're in a total brain fog, even though they think they slept all night.
Now for the other side of the coin, the symptoms that happen while they're sleeping. And here's the thing. The patient usually has no idea these are happening. Your best source of information is almost always their bed partner. They're the ones who will tell you about the super loud snoring, or maybe even scary moments where the person gasps or chokes for air. They'll see them tossing and turning all night. These are giant flashing red flags for OSA.
So, if you suspect OSA, how do you prove it? Well, the gold standard diagnostic test is called a polysomnogram, or PSG for short. It's the official overnight sleep study where they hook you up to a bunch of monitors. It's amazing what it tracks: brain waves, heart rhythm, breathing, and most importantly, it tracks your blood oxygen levels. This gives doctors a crystal clear picture of exactly what's going wrong during the night.
Okay, so once we have a diagnosis, what do we do about it? This is where we as nurses really shine. Let's talk about interventions for sleep disorders, and we're going to start with lifestyle changes first, because you should always try those before jumping to meds. And the number one first-line intervention is always sleep hygiene education. It costs nothing, has no side effects, and it gives the patient power over their own health. The biggest thing to stress is consistency, going to bed and waking up around the same time every day, yes, even on weekends. And then you have the classics. Cut the caffeine late in the day, put away the phone and turn off the TV before bed, and make sure the bedroom is like a cave, cool, dark, and quiet. Don't underestimate how much of a difference this can make.
All right, but sometimes sleep hygiene just isn't enough, and that's when we look at medications. Let's run through this chart, focusing on the must-knows for your exam. First, benzodiazepines. Think high risk for dependence and respiratory depression. Big red flag. Then you have the Z drugs like zolpidem. Watch out for weird sleep behaviors like sleepwalking or even sleep driving. Now star this one, trazodone. Huge NCLEX alert. It's super common, but you must teach male patients about the risk of priapism. That's a medical emergency. Finally, even simple OTC stuff like antihistamines can cause problems, especially anticholinergic side effects like confusion in your elderly patients.
You got all that? Good. Let's lock in that medication knowledge with another practice question.
Okay, listen closely. A male client is prescribed trazodone for insomnia. Which potential side effect requires immediate patient education and reporting? Is it number 1, mild morning drowsiness, number 2, dry mouth, number 3, a persistent painful erection, or number 4, increased appetite? Which one is the emergency?
And the correct answer is, of course, number 3, priapism. Look, a little drowsiness or dry mouth, that's annoying, but it's not an emergency. Priapism, on the other hand, is a true medical emergency that can lead to permanent damage if it's not treated right away. This is a non-negotiable critical safety teaching point for any male patient taking trazodone.
All right, we're moving into our final and maybe most important section, caring for people with a serious mental illness, or SMI. This is where nursing becomes so much more than just tasks. This is about compassion, advocacy, and understanding some really complex human challenges.
I want you to just look at this number for a second. -25 years. That is how much shorter the life expectancy can be for someone with a serious mental illness. 25 years. And here's the kicker. It's not because of suicide or the mental illness itself, it's because their physical health problems like heart disease and diabetes go untreated. This is a massive, tragic health disparity that we have to address.
Okay, if there is one word you take away from this section, please let it be this one, anosognosia. It's a game changer. It's a neurological symptom where the person's brain is incapable of recognizing that they are ill. So when your patient with schizophrenia tells you, "I feel fine, there's nothing wrong with me," it's not them being stubborn. It's not denial. It is a symptom of their brain illness just as much as a hallucination is. Understanding this changes everything about how we approach so-called non-compliance.
And that lack of insight, that anosognosia, is just the tip of the iceberg. These individuals are dealing with a mountain of challenges. They're trying to manage terrible medication side effects. Many are also struggling with substance use.
They're fighting against stigma every day, and often dealing with poverty and homelessness on top of it all. It's not one single thing, it's this tangled web of issues that makes recovery so difficult.
So what's the answer? It's definitely not just locking people up in hospitals. The solution lies in the community. We need strong, accessible resources like case managers who can help coordinate all the moving parts of their care. We need peer support specialists who've been there and can offer real hope. We need housing services, job training. All of these pieces working together are what actually help people build stable, meaningful lives.
Okay, one final practice question to make sure this all sticks.
All right, here we go. A client with schizophrenia consistently refuses their medication, and their reason is, "I'm not sick, there's nothing wrong with me." As the nurse, you recognize this is most likely due to what? Number 1, denial. Number 2, anosognosia. Number 3, stubbornness. Or number 4, medication side effects.
And the correct answer is number 2, anosognosia. This is a perfect test of that concept. Their statement, "I'm not sick," isn't a choice. It's not a coping mechanism like denial. It is a classic symptom of the neurological illness itself. They genuinely cannot see that they are sick. It's a crucial distinction to make as a nurse.
I want to leave you with this incredible quote from Patricia Deegan. She's a psychologist who also has lived experience with schizophrenia. And she says, "The goal of recovery is not to become normal. The goal is to embrace the human vocation of becoming more deeply, more fully human." And isn't that just perfect? It brings everything we talked about, CHIME, wellness, empowerment, full circle. It's not about erasing an illness. It's about helping someone live their fullest life. Thank you so much for joining me today. Go crush those exams.